Okay, today we're going to be doing AED for adults. Tomorrow we'll do AED adult scenario where I'll read you a passage and then give you one prompt. And you'll have to be able to go through all the steps without me telling you anything the whole entire way. And you'll work through everything in its entirety. Today, you'll just put the pads on, go through the first cycle of CPR. When it gets to the second cycle, I call the dogs off and you're done with that. Not a very difficult thing. Okay? I will do a demonstration for you so that you're comfortable with it. All right? Tomorrow, the blue group, which is the first group, you have your current event due. All right, so make sure you get that in my hands. You should know who you are at this point. Any questions about what you guys did yesterday? I think everybody in this class turned everything back in. Yes, sir?
What does it mean by current event? What's that mean? What does it mean by current event?
The current event that we do twice a quarter. You have to find an article, submit it. It was in the initial packet that I gave you. I talked about it. I went over it. I reviewed it. If you have some questions later, I can sit and talk to you about it.
Sure.
Okay? Not a problem. All right. Anything else from you guys? Anything about yesterday? You guys did a good job. What he did for me was he made sure that you were doing your work, and he gave people credit for getting things done, and I appreciate that. Everybody should have gotten a rubric from back there to be able to submit to me while you're doing your testing. That way I can check off if you did everything right or address what might not have been done correctly. Before I get into that though, like I said, I would like to basically go over with you how you handle somebody who's extremely hairy. And I couldn't think of a more hairy person to put a picture up of with a link underneath attached to him than Chewbacca. So take a look at this first of all.
If a victim has hair on his chest, the hair may prevent the pads from sticking. The AED may tell you to check the pads. If this happens, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set to the bare skin. If your AED supply kit has a razor, you can use this to shave the area as well, and then reapply a new set of pads.
They asked me in the last class, they said, "You think that's a real person?" "Yeah, what do you think?" You know, I'm sure it was painful though to do that. I am not going to cover the notes with you because they're just precautions. However, while people are doing the testing, I'll have the precautions up here and I'll kind of go through them so everybody can write down the precautions. It's on page 22 in your note packet. And I will go over them briefly before we do anything else at some point, but you need to know. All right? So we'll start there. Let's take a look at actually how to use an AED. Now it's going to go over AED for adult, child, and infant, because child and infant can be handled a little bit differently.
Every year, thousands of people die of sudden cardiac arrest.
She's unconscious. Go to the front desk, call 911 and bring me the AED.
Following the links of the cardiac chain of survival can help save lives. The sooner 911 is called, the sooner advanced medical care will arrive. Early CPR helps circulate blood that contains oxygen to vital organs. Most people experiencing sudden cardiac arrest need an electrical shock called defibrillation. Continue CPR until an AED is ready to use. An AED, or Automated External Defibrillator, is a portable electronic device that analyzes the heart's rhythm and determines if an electrical shock is needed to help the heart restore an effective rhythm. Most AEDs can be operated by following these general instructions. Turn on the AED. The AED will tell you what to do next.
Press pads firmly to patient's bare skin.
Make sure the person's chest is bare and dry. Use a cloth or gauze pad to dry the person's bare skin where the pads will be placed. Remove the pads from their packaging. Carefully peel off the backing from one pad and place the pad on the upper right chest. Place the other pad on the left side of the chest. Plug in the connector to the AED if necessary. The AED should start analyzing the person's heart rhythm.
Analyzing heart rhythm. Do not touch patient.
Analyze.
Do not allow yourself or anyone else to touch the person while the AED is analyzing.
Shock. Move away from the patient.
Make sure that no one, including you, is touching the person.
Red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.
After a shock is delivered, or if no shock is advised, give about 2 minutes or 5 cycles of CPR. When 2 minutes have passed, the AED should automatically begin to reanalyze the heart rhythm and will advise you with a prompt to stay clear of the person.
Do not touch patient. Analyzing heart rhythm.
Continue to follow the prompts of the AED and provide care as needed.
It is now safe to touch the patient. Start CPR.
If at any time you notice an obvious sign of life, such as breathing, stop CPR, maintain an open airway, and monitor for any changes in condition. An AED can also be used for children and infants who are not breathing. Use pediatric pads if they are available. Operate the AED and apply the pediatric pads to the child's chest the same way you would for an adult.
Do not touch patient. Analyzing heart rhythm.
Analyzing. Everyone stand clear.
For a small child or infant, the pediatric pads may be too large to fit on the chest without touching each other. You may need to attach one pad on the center of the chest and the other on the back between the shoulder blades. Here is how you would work with a second trained responder when using an AED. One responder continues CPR while the other prepares the AED. This is another example of how CPR and an AED work together as links in the cardiac chain of survival. One responder continues CPR while the other attaches the AED pads and operates the AED.
Do not touch patient. Analyzing heart rhythm.
Everyone stand clear.
Preparing shock. Move away from the patient.
Shock advised. Everyone stand clear.
Press red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.
We started the person
All right, so let me do a little demo for you. We'll talk about a couple of things here before I even get into my demo. First of all, don't write anything down behind me right now. Stay focused on what I'm doing here. If you start writing down, you're going to miss exactly what I do here, and I don't want you to do that. All the pads have been changed, so everybody's pads will stick to the mannequin. Okay, I changed them with the first period class. They should be good for this day, and I've got more to change out. But we have two different sets of pads that are in our bags. This bag, actually, I took the small ones out too. But you have a set of pads that has a yellow connector, and you have a set of pads that has a blue connector. There's a visible difference between the two. Let me see. There's a visible difference between the two in terms of size. These are for a child, these are for an adult, or a bigger person, bigger child, I should say. Okay, these are for an infant, bigger person. The connectors, again, dead giveaway. With the pads, when you go to put them on somebody, it shows you clearly where they belong on the person. Okay, so there's a little sketch of the person and where you should put it on at. I teach everybody to put the pads on, then plug them into the connector. Simply because this thing gets started, it starts talking to you right away. There's going to be 6 machines going at the same time. I also recommend that if you get into a health field or something where you may need to use this again, you put the pads on first. It simplifies your life a little bit, knowing fully well that it's ready to go, you hit a button and you've had to move away from the body. Whereas if you got the machine on and you got to put the pads on, you're still in contact with the body as the machine's talking. Remember, we never want to touch that body while the machine's working. Otherwise, it could get a false read in terms of a heartbeat, and we won't be using it. It'll tell us we don't use it. I had a couple of really good questions asked in first period. One was, does it tell you if the person's dead? If it tells you to shock the person, that means they're in cardiac arrest. That means they're dying. Okay? I had somebody else ask me, does it tell you if the person's alive? Which was a very valid question. If it tells you don't need to shock them, you don't need to give them CPR, that means there's a heartbeat. That means they're alive. Okay? So those things are very important. I had the question asked, are they all battery operated? Yes, they are. They have to be. Okay, they have to be. We've got 3 of them in this school that I know of, and I got that information from security because security is the one responsible for checking them. We've got one outside the athletic director's door down there in a little white case. We've got one up at the by the tennis courts in a little building up there, and we've got one down here in the building on the track. Technically, we should probably have 3 in this school. A school this size, we should have 3. Because if something would happen up in, say, 356, and they'd have to come down here to athletic director's office and get it and go back up there, that's going to take some time. And you guys know that for every 1 minute you delay using it, you can lose about 10% of a person's life. So I'm not real sure why they do that. Also, another thing that is good information but not necessary for you guys, if you play in a sport and you go off campus to practice, you should have an AED with you. When I was teaching at Rockville, we only had one practice place, and in the fall, football was the only one that could use it. It's just, that's how small the practice area was. So all our sports had to go off to the middle school or the elementary school surrounding it, and basically what would happen is they would have a portable AED they'd take with them in case something would happen. So those are very important things. I know we watched the one video about the young girl in Texas and how they revived her and everything, and they said that these should be in every business and school. They are now. They really are. If you have a private business, I don't know what the law is for that, but public buildings and things like that, they've got AEDs. They've got AEDs. Okay? Any questions? All right, so we're going to escalate to the final stage of where I've been bringing you from checking the unconscious person to giving CPR, now to using an AED. So you just go through the procedure as normal. Are you okay? They don't respond. Call 911, get me an AED. Any sign of life? No sign of life. Now remember, the AED hasn't arrived yet, so I... Breathe in, pinch the nose, take your mouth off of them, pull your fingers off the nose. I'll have you do 1 cycle, and then I'll tell you the AED arrives, okay? Look at your pictures, put your pads on accordingly. Then plug it in.
Analyzing rhythm. Everyone
And
stand
we're off to the
clear.
races.
Shock advised. Charging. Everyone stand clear. Everyone stand clear. Push the shock button.
The shock button is blinking yellow.
Shock delivered. Begin 5 cycles of CPR.
And you follow the procedure now. You'll hear it doing that. Click, click, click. The click is the heartbeat rhythm. You can just stay with that. It'll count down for 2 minutes. It'll get down to 130, 1 minute, 30 seconds, and then it'll tell you, move back, I'm going to evaluate them again. Okay? For all intents and purposes today, you're done at that point. The machine will shut itself off. Normally, you would just continue doing what the machine
1 minute
tells
and
you.
30 seconds of CPR
Okay.
remain.
Questions? Comments? Concerns? And I'm a great waiter. 10-second wait time. Okay, great. When you're done, make sure you take the pads off and put them back onto the pad holder thing. I don't know what you call it. Everybody should have a rubric so that when you come to see me, you bring it to me.